Why old women lose balance, hidden causes and simple fixes. A silent struggle few talk about. Have you ever noticed how many elderly women start to walk slower, more carefully, maybe holding onto walls or furniture? Behind that simple change is a powerful, sometimes frightening truth: loss of balance. It's one of the most common yet overlooked challenges that older women face. And here's the catch. Most people assume it's just old age, something natural. But the reality is far deeper and far more preventable. Balance is tied to bones, muscles, brain function, medications, and even shoes. If you're a woman over 60, or you love someone who is, understanding why this happens could literally prevent a life-changing fall. In this video, we'll break down why old women lose balance, what's happening inside the body and brain, and what simple changes can help. Let's start this journey, not just to learn, but to stay strong, steady, and safe. Cause number 1, muscle loss, sarcopenia. Let's begin with one of the biggest culprits, muscle loss, known as sarcopenia. Starting around age 30, we begin losing muscle mass. Slowly at first, then more rapidly after 60. For women, hormonal changes like the drop in estrogen after menopause accelerate this process. And here's the key: muscles aren't just for strength. They help with posture, stability, and reflexes. When leg and core muscles weaken, it becomes harder to stay upright, especially when walking, climbing stairs, or reacting to an uneven surface. The hips and thighs are crucial here. Without strength in those areas, even standing from a chair can feel shaky. This isn't just aging, it's biology. But the good news? It can be slowed or reversed through gentle strength training, walking, or even chair exercises. Cause number 2, bone loss and weak joints. The second major reason older women lose balance is bone loss, especially in the hips, knees, and ankles. Osteoporosis, a condition that weakens bones, is extremely common in postmenopausal women. As bones become brittle, the structure that holds your body upright becomes less stable. Add to that joint stiffness from arthritis or inflammation, and you get a recipe for poor balance and higher fall risk. Even the simple act of stepping down a curb can feel risky. Joints may lock, creak, or give way unexpectedly. And because women generally have smaller bones than men, the effects are more severe. The solution isn't just calcium or supplements, it's movement, posture, and proper care. Awareness is the first step. Cause number 3, inner ear and balance system issues. Balance isn't just about legs, it starts in your ears. Deep inside each ear is a tiny structure called the vestibular system. It's your internal GPS. It tells your brain where your body is in space. But with age, that system can become less sensitive. Some women develop conditions like benign paroxysmal positional vertigo, BPPV, where a simple head turn can make the room spin. Others may experience hearing loss or fluid buildup, which confuses the balance signals. It's disorienting and sometimes dangerous. Imagine standing up and suddenly feeling like the floor moved. That's not weakness, it's your brain getting the wrong message. Fortunately, vestibular therapy and certain head exercises can train your body to adjust. So yes, your ears play a bigger role in your balance than you think. Cause number 4, poor vision. Did you know your eyes help you balance? Your brain relies on what you see to orient your body. When vision declines, whether due to cataracts, glaucoma, or just poor lighting, your brain loses an important source of balance feedback. Many older women stumble not because of weak legs, but because they couldn't see a rug edge, a stair step, or a pet underfoot. Add in poor depth perception, and everyday tasks become risky. It's like walking with a foggy windshield. That's why routine eye exams, proper lighting at home, and using the right glasses are more important than ever. Protect your sight, because it protects your balance. 'Cause number 5, medications that disrupt balance. Here's one many people overlook: prescription medications. Many older women take several daily pills for blood pressure, anxiety, sleep, or arthritis. Some of these, especially sedatives, antidepressants, or blood pressure drugs, can cause dizziness, drowsiness, or muscle weakness. This is called polypharmacy, when multiple medications interact in harmful ways. You might feel lightheaded after standing up, or suddenly unsure on your feet. The problem isn't always the drug itself. It's how it combines with age-related changes in liver function, circulation, or hydration. If balance has become an issue, always check in with your doctor or pharmacist. You might be able to adjust your dose or timing to regain clarity and strength. 'Cause number 6, lack of physical activity or movement. Use it or lose it. That saying becomes painfully true after 70. One of the biggest causes of balance loss is simply inactivity. Sitting too much leads to weaker legs, tighter hips, and slower reflexes. Many older women avoid movement because of fear. Fear of falling, of getting tired, of looking silly. But ironically, the less you move, the more unstable you become. Regular walking, gentle stretching, or even Tai Chi can train the body to stay upright. Movement also improves blood flow to the brain, keeping balance centers active. Even 15 minutes a day makes a huge difference. It's not about being an athlete, it's about keeping your body talking to itself. And the more it talks, the more stable you'll be. Empowering tips: what you can do today. Now that you know the causes, what can you do? First, don't ignore the signs. Feeling wobbly isn't normal. It's a signal. Second, start with small, safe habits. Rise slowly from chairs, keep your home clutter-free, and wear supportive shoes. Add light exercises like leg lifts or walking in place while brushing your teeth. Get your eyes and ears checked regularly. Review your medications with your doctor. And perhaps most importantly, believe you can improve. You are not powerless. Your balance can be strengthened just like a muscle. Even in your 70s, 80s, or 90s, you can regain stability and confidence. You are stronger than you think. If you've been struggling with balance or watching a loved one hesitate with every step, know this: you are not alone and you are not broken. Your body is still capable of healing, strengthening, and adapting. Understanding the why behind balance loss is the first step to taking control. You've lived through decades of change, and this is just one more thing you can face with courage. So don't sit down and give up. Stand tall. Walk proud. You are stronger than you think.